We are now on lab number 3, and this is axial skeleton, the vertebral column, and thoracic cage. A little refresher from last week's lab, axial versus appendicular skeleton. Remember, the axial skeleton includes the head, neck, chest, and back. It's the axis, or like the middle supportive part of the body. This contains all of the cranial bones, facial bones, the vertebrae, and the thoracic cage. The appendicular skeleton involves everything within the arms and the legs and the attachment bones for them to the axial skeleton. So this is your arms, legs, your pelvis, and your shoulders. First, let's talk about the vertebral column. So the vertebral column is your spinal column. It makes the framework for your back. It protects and surrounds your spinal cord. It makes the central axis of weight for our body. It supports our head, and it allows for us to rotate and bend. So the spinal column, or the vertebral column, is broken up into 5 regions: the cervical, the thoracic, the lumbar, the sacrum, and the coccyx. Before we go into each region, I want to give you a few terms that you're going to hear repeated throughout the vertebral column. So first we have facets. So facets are semi-flat, they're relatively flat, smooth plate-like areas where joints connect in the spine. So if you look on this picture, it's the blue area. That's where another bone will articulate with that the vertebrae. So the other bone that articulates with that is going to have a projection or a knob that little plate is on, and that's called a process. Remember, we talked about processes last week, and they're like little projections or knobs or little things that stick out. And then this has articular facets, which are facets where the vertebrae move with the next vertebrae. Articulation means to move with. And then there are costal facets. So costal means rib. So the costal facet, if you look on the side here, on the right side of this picture, you can see that this is a rib, and it's connecting at these 2 little blue facets. So a costal facet is where the ribs connect to the vertebrae, specifically the thoracic vertebrae. So facets, processes. Those are going to be repeated throughout the whole vertebral column PowerPoint. And it's just kind of important for you to remember what they are. It's very repetitive. All right, so the first section of your vertebral column is your cervical spine. So cervical refers to neck. So your cervical spine is the part that is your neck. So there are 7 individual vertebrae in your cervical spine, and they are numbered starting at the top, going down. All the vertebrae are going to be numbered from top down. Okay, so your first 7 vertebrae, starting at the back of your head, are all part of your cervical spine. They're numbered C1, C2, C3, and so forth. C stands for cervical, and the number tells you which one we're talking about. So it gives you a general location. So the vertebrae are connected by facet joints, which I explained in the last slide. The little blue smooth plates where another bone can articulate with them. These joints allow for rotation, forward and backward movements of the neck. So the cervical spine is mainly involved in movement of your neck and supporting your head. It protects your spinal cord, nerves, and arteries that run through that area. And like I said, it allows for head and neck movement. Some key features of cervical vertebrae will help you easily identify them. So one of the main features of vertebrae is the vertebral foramen, which is the center foramen here, and that allows for the spinal cord to pass through. Every vertebrae is going to have a vertebral foramen because its job is to surround and protect the spinal cord. So of course it's going to have an area for the spinal cord to go through. Then there's the spinous process. And if you look here, it's at the bottom. It looks like 2 little legs coming off the back of the vertebrae. Cervical vertebrae have like 2 little knobs for their spinous process. That's a key indicator that this is a neck vertebrae and not a thoracic or a lower back. There are transverse foramens, and transverse means side, and remember foramen means hole. So on either side of the body of this vertebrae are these 2 little holes. These are the transverse foramens, and they allow for the vertebral artery and vein to pass through, which supply blood. And then there's a transverse process. The transverse processes are these little knobs that are right next to the transverse foramens. And then in the cervical vertebrae, there is a pedicle. Pedicle is the connection point between the body and the transverse process. So it's underneath the foramen in this little area right here that kind of connects the transverse side to the body. So these are the key features of a cervical vertebrae. Some more key features of the cervical vertebrae include the superior and inferior articular facets. So if you remember back, we talked about facets being those smooth plate-like areas where one bone articulates with another. And again, articulate means move. So where two bones articulate, it's where usually a joint happens for bones to be movable. So in the cervical vertebrae, they all have a superior and an inferior. So a top and a bottom articular facet. These allow for one vertebrae to hinge and kind of move on the next one after it. And that one has the facets to hinge on the next one after that, and so on and so forth. So looking at this picture, you can see that the superior articulate facet is showing. You can see it's got a smooth center. We're looking at this vertebrae from a superior view, so top down. We're looking down into it, okay? So the superior articular facet is nice and smooth and round. You can see it's pointed out very easily with the arrows. The inferior is going to be the round area underneath it. You can see that there's a little, looks like a rounded area underneath it. It's the same thing on the other side. Okay, so the superior is on the top, the inferior is on the bottom. They have the exact same job. The top one articulates with the vertebrae ahead of it, like the vertebrae in front of it. And the inferior one, or the bottom one, articulates with the next vertebrae down. So if this was your C3 vertebrae, the superior articular facet is going to articulate with your C2, and then the inferior one is going to articulate with your C4. All right, so as well as having the facets, we have the superior articular and inferior articular processes of the cervical vertebrae. So remember, the facets are smooth areas and the processes are like little projections. The processes are the little projections that the facets are on. So the facet is the smoothed area on that little projection. And if you look at this picture, you can see over here how they are labeled superior and inferior articular process. And you can see the facet right there on the superior one. So you know that the process is the little bony projection that the facet is actually on. And again, their function is for articulation, to make it more stable and to make the hinges of the vertebrae work better. So all of our vertebrae are named based on location and numbers. C1, C2, T1, T2, except for our first two cervical vertebrae. They have their own name. They're very special. So our C1 vertebrae is our atlas. And it's called the atlas because in Greek mythology, Hercules held up the earth and it was like the atlas. And he was called the axis because he was holding up the earth. So the head is considered the earth. It's on its atlas, which holds it, and it revolves on its axis, which allows for it to move. It's like a Greek mythology thing. But C1 is called the atlas. The atlas is a special shaped vertebrae. So if you look back at the other vertebrae, this one looks a lot different. It has a really big foramen, and it doesn't really have the processes or the spinous projections or the spinous processes on it like the other cervical vertebrae do. This one's designed specifically to support the head. So this allows for your head to be upright and nod back and forth and side to side. So there is the big vertebral foramen in the middle of it. Like every other vertebrae, it has a vertebral foramen to allow for the spinal cord to go through it. It has transverse process. These little knobs on either side. Transverse means side. Remember, process means projection. These terms are going to get very repetitive because every vertebrae has very similar features. And then there's the transverse foramen of the axis, which houses a vertebral artery and vein, and it's in the same place as it was in the cervical vertebrae. So the transverse foramen is the hole on either side, the vertebral is the middle, and the transverse process is the little projection off to the side. And remember, the atlas is your C1. It's your very first vertebrae, and it articulates with the occipital bone of your skull. All right, our C2 vertebrae. This one is our axis. So the atlas moves on the axis. So atlas is 1, axis is 2. So the axis is a special shape, just like the atlas, but it is more similar to the other cervical vertebrae. So if you look at this picture, you can see that it looks similar. It has a spiny process like the other cervical vertebrae, but it's bulkier in the front. So the front of this has this bulky middle portion. And remember, this is a top-down view. We're looking at a superior view. So the middle version of this at the top is the dens. This is an upward protrusion, or it kind of looks like a tooth. That's why it's also called the odontoid process. Dont means tooth, or odont means tooth. So this is tooth-like. And what this does is it allows for the axis to sit on it and pivot with stability. This has a spinous process in the back, just like the other cervical vertebrae. And this is a muscle attachment point. All the spinous processes are a muscle attachment point for our neck and back muscles. And then there's the transverse process, which is these little notches on the side. And the transverse foramen, which is these foramens on the side that allow for the vertebral artery and vein. And then that is it for the axis. Just remember, this is the C2, and it has a special name because it's very, very important for head movement. So moving on to our thoracic spine. So first we have the cervical, and then we have the thoracic. And if you think about what thorax means, or thoracic, it means chest area, because remember, the thoracic cavity is the heart and the lungs. So the thoracic spine is in our chest area. This is the middle section of the vertebral column, and there are 12 vertebrae in this section. They are numbered 1 through 12, starting from the top, just like the cervical vertebrae. They protect the spinal cord, any nerves that may be connecting to it in that area, and any arteries that may be coming from that area. One of the major roles of the thoracic vertebrae is rib attachment. So the thoracic vertebrae have their own facets. And if you remember back to the facet slide, we talked about costal facets. These are the vertebrae that have costal facets because the ribs only connect to the thoracic vertebrae. So it's an attachment point for ribs, and we all know that the ribs are really important for protecting our organs. It provides an attachment and stability point for the abdomen and abdominal muscles. So all of the spinous processes on these are going to be attachment points for muscles. And then this region allows for your spine to twist and bend. There are discs in between the vertebrae that allow for movement. And this is the least flexible portion of your spine. So the other portions are a lot more flexible than the thoracic vertebrae. So just looking at the thoracic vertebrae, we can notice that it looks different from the cervical vertebrae. Keep in mind these key differences, because when you have to identify the different vertebrae, it's nice to be able to easily differentiate between cervical, thoracic, and lumbar. So thinking back to the cervical had 2 little processes coming off for the spinous process. The thoracic only has 1. It does have a spinous process, and it is on the back, but there's only 1 little projection. This is an anterior view, so this is a bottom-up view of the thoracic vertebrae. You will notice that it has the vertebral foramen, again for the spinal cord to pass through it, but there are no transverse foramens. So there's only 1 foramen in the thoracic vertebrae. There are facets, which again allow for articulation with prior and the next vertebrae. The inferior and superior, just if you can remember, inferior is bottom, superior is top, you can easily identify which facet is which. And then it does have transverse processes, which are these little side knobs, little projections coming out either side. Now we're moving on to our lower back, or our lumbar spine. So this is our lower back. There are 5 vertebrae in the lumbar region, and they are numbered just like the other vertebrae, but L1 through L5, starting from the top. These support upper body and distributes our weight. It allows the trunk to move in many directions, twisting, bending. This is the most flexible area. And then it protects the spinal cord, nerves, and arteries that are in that area. The lumbar vertebrae are thicker than the others because there is more weight being distributed onto them. They hold the majority of the weight, so they're going to be fatter. Some key features of the lumbar vertebrae are it's really thick compared to the other vertebrae. And this is because there is a lot of weight put on the lumbar spine. It supports a lot of weight for our body, so the thicker bones, the better and the stronger. The vertebral column is more narrow in the lumbar vertebrae compared to the thoracic and the cervical, because as we get further down the spinal column, our spine starts getting more narrow because it's coming to the end. So it would only make sense that the foramen for the spine gets narrow as the spine gets narrow. Similarly to the other vertebrae, the lumbar vertebrae have a spinous process. It is thicker and it is just one, similar to the thoracic vertebrae. They have a vertebral foramen, just like all the other vertebrae, and they have the superior and inferior articular processes, and they also have these little facets. So the facets and the processes are thicker in the lumbar spine because of weight support. A lot of the support for your core goes into your lumbar. That's why people get lower back pain instead of upper back pain. It's a lot of the weight is distributed on the lower back. So after we get past the lumbar, we come down to the sacrum and the coccyx. So the sacrum is the very bottom area of your vertebral column. It consists of 5 fused vertebrae. They are located between either one of your hip bones, and they are numbered S1 through S5. They follow the same pattern as all of the other vertebrae for their naming. And these ones mainly stabilize and connect the bones of the pelvis. And if anybody knows anything about the center of gravity, our center of gravity, especially for females, is in our hips. Men's is a little higher, but the hips do play a huge role in that. So the sacrum gives a lot of stability, and it also carries the most weight out of any part of our spine. So it's fused together. If it was not fused together, there probably would be some crushing because of the weight. So it's fused. There are 5. They provide stability and a lot of weight distribution. After that, we have the coccyx, which is our tailbone. This usually doesn't do anything. It has minimal support to the pelvic organs. It's very easily broken, so the support is not great. Oftentimes when women are giving birth, they can break this just because it's really, really tiny and fragile. And it doesn't really have much use other than that. It's possible that it can provide some support, but not really. The sacrum is really easy to identify because it looks like 5 vertebrae melted together. So there's some key features that are important to know, but identification on this one's pretty easy. So if you look at this, there's this flat plate or facet area at the top called the base. This area articulates with the L5 or the last lumbar vertebrae. The ridge of this is called the promontory. So the promontory is the area that articulates with the L5, and it creates the lumbosacral joint. So lumbosacral means lumbar, sacrum together, joint. So it's the joint between the lumbar and the sacral spine. You need to know about the anterior sacral foramen. So these are all the foramens in the sacrum. They're all sacral foramens, and the anterior ones are going to be on the front. So if you look here, you can see these little the superior articular processes. You can see the facets are on the posterior view, but not on the anterior view. The anterior sacral foramens are going to be the one on the side that does not have the facet. And then the superior articular process of the sacrum, we already talked about those. And just like every other process, the articular processes, they articulate with something else, and the thing that comes before the sacrum is the L5. So the base and the process are all going to articulate with the lumbar. So now we have our thoracic cage. So the thoracic cage is the cage of the thorax area. This consists of your ribs, your sternum, and your thoracic vertebrae. The main function of this is to protect the lungs and the heart, our vital organs, and they also allow for breathing because the cartilage And our ribs is very flexible, so it allows the bones of the rib cage to rise and fall as our chest rises and falls while we're breathing. So starting with the thoracic cage, we'll start with the sternum. Start right in the middle. Your sternum is your chest bone. Its main job is to protect the vital organs and provide a place for rib attachment on the front side or the anterior side of the body. The sternum creates the anterior or the front wall of the chest, and it is divided into 3 different regions. So first we have the manubrium, which is this triangle, weird, it's kind of a triangle-y shape, but not really. It's kind of weird shaped. It's the very top, and this allows for articulation of your clavicle or your collarbone. Then we have the body, which is the main part, the most functional part. If you look here, you can see that the majority of our ribs are connected to the body of the sternum. It's the largest part, most functional part, just like every other body that we've talked about. And then the very bottom, you have the xiphoid process. So the xiphoid process is a cartilaginous process. At the very end of the sternum, it starts off soft, and then it ossifies or hardens as you get older. And the main thing with the xiphoid process is it's the site for CPR. So if you're going to do CPR on somebody, you're looking for the xiphoid process to start for your chest compressions. All right, so the costals. These are our ribs. Costals means ribs. If you hear anything costal or intercostal, it's pertaining to the rib area. So our ribs, we have 7 sets of true ribs, 5 sets of false, and 2 sets of floating. So this means we have 14 true, 10 false, and 4 floating ribs in total. The difference between true, false, and floating is how they attach or how they don't attach to the sternum. So your true ribs are going to attach directly to the sternum with costal cartilage. So if you look at the purple ribs, you can see the purple ribs go and then they stop and it turns into white cartilage and then it attaches to the sternum. Those are true. And they start with, there's 7 and they start at the top and it's 1, 2, 3, 4, 5, 6, 7. They connect to the first 7 thoracic vertebrae. So remember, the ribs connect to the thoracic vertebrae, not the cervical, not the lumbar. They connect to the thoracic. So we have 7 true, and then we have 5 false. Okay, the 5 false include the 2 sets of floating. Okay, because remember we have 12 thoracic vertebrae, so we should have 12 sets of ribs, right? So the first 3 are false ribs. They're not floating because they do attach to the sternum. They just don't attach directly to the sternum. If you look at the pink ones, you can see how the cartilage all attaches together and then that attaches to the sternum. The ribs themselves don't actually directly attach to the sternum. Those are false ribs. And then the very bottom, you have these green floating ribs. These ribs do not attach to the sternum in any way. They only attach to the T11 and T12 vertebrae of the spine. So all of this cartilage that is attaching these ribs to the sternum is called costal cartilage or rib cartilage. It is very, very flexible. It's found at the front side of the ribs where they connect to the sternum. And this allows for your chest to rise and fall and the rib cage to stretch and flex with that. So we can take deep breaths, we can inhale, exhale easily. Also, the ribs are really important because they protect the organs behind them. The majority of our abdominal organs are covered by some portion of the ribs, especially the lungs and the heart. The last little piece of the axial skeleton, is going to be the laryngeal skeleton. Laryngeal refers to the larynx area or our voice box. So the laryngeal skeleton is composed of 9 cartilages and it protects the thyroid and the trachea, so our throat. It allows for the opening and closing of the glottis, and this is how we produce sound. So it's not really bones, but it is important because it is a protection structure for our throat, and it also allows for us to open and close parts of the larynx or our voice box, because if we couldn't do that, we wouldn't be able to produce sound. So this is the laryngeal skeleton.